Dr. Sharma, my next question I will address to you. There's a lot of talk about undergoing annual health checkups, right? There are hospitals also which advertise various kinds of packages for annual health checkups, and they are also targeted towards a particular kind of constituency or audience. Which kind of tests would you recommend for people to undergo annually? Would you say that people who are more at risk, people who already suffer from these risk factors, who are diabetic and who are those the kind of people who should undergo these tests annually, right? And which kind of test would you recommend for such group of people to undergo?
See, the concept and design of health check came with the idea to keep their employees healthy,
right,
and gainfully employed by the different corporate body. But that subsequently translated into the general population.
Right.
So health check today, it has both scientific reason also and commercial reason also. So if we go more by a scientific dictate, yes, people who are at certain age and especially with the risk factor, then routine health check should be done.
Right.
Now, when the person reaches a particular age, say like beyond the age of 40, then the chances of developing many of these lifestyle diseases become more, because many of the people are diabetic, they don't know they are diabetic. Many of the people have high cholesterol level, they don't know they have high cholesterol. So to pick up this pathological process early in the disease and intervene so that this disease can be modified and the heart disease can be prevented.
Right.
So that is the idea behind the health check. So
right.
My take on is that yes, all the people who are at a particular age, say like 40 and beyond, and especially if they have family history or they themselves are diabetic or high blood pressure, or they are engaging in a unhealthy lifestyle, that they are overweight, they don't exercise, they are a smoker, then altogether there is necessity of doing health check.
Right.
Coming to these are the advantage, no doubt. We pick up the disease or biochemical abnormalities in our system early in the process so that we can intervene. But there are downside of health check also. People are absolutely healthy. Sometimes when they go health checkup and they find some of the abnormalities and they end up in a vicious cycle. Especially it comes to the heart disease, then this problem is more. Like in health, most of the health check package has a non-invasive testing like treadmill test.
Right.
Person undergoes treadmill test, he is absolutely fit, asymptomatic, and treadmill test come positive.
Right.
Then he has to undergo the next test.
Right.
Next to next. So like that, he is declared he has a blocked artery. Right. Now the question at that point of time, question comes, should we do intervention or we manage medically? So they end up in a vicious cycle. So right. Selection of the person for a health check should be based on his risk factor profile, especially age and other accompanying risk factors. As far as the type of test pertaining to the picking of heart disease is concerned, other than basic clinical examination, we just need basic biochemical profile in terms of picking up diabetes. So blood sugar, fasting postprandial blood sugar, a marker of glucose control is a HbA1c, lipid profile, basic liver and kidney function test, and basic non-invasive tests like ECG and stress test and echocardiography. That is good enough to declare a person whether he has any underlying disease or any underlying biochemical abnormality, or sometimes, we pick up person already has silent heart attack and there is a evidence in the echocardiogram, or we pick up some other undiagnosed disease. Many of the congenital heart diseases are undiagnosed. Sometimes a large heart is undiagnosed. So those things can be picked up. So there is a role of health check, but it should be directed towards the people who are at risk.
Right.
Not for a 25, 30-year healthy young person to have a health check.
Right. Sir, you've explained very well the fact that not everybody needs to indiscriminately go for these annual checkups. Only those who are more predisposed and more vulnerable to developing the disease, who have a certain kind of risk profile, they are the ones who should go for these tests. And even these tests are a certain kind of tests, as you said, diabetes, hypertension, lipid profile, rather than going in for a battery of tests which are not really needed.